Did you know that a sleep position millions of folks over 50 use every single night could be quietly forming dangerous blood clots? Top neurologists, who have treated hundreds of stroke patients, warn that this common habit is like a ticking time bomb waiting to go off. Many people think their favorite sleeping posture is perfectly safe, totally unaware of the hidden danger happening right inside their neck. Take Stephen Martin, a 72-year-old retired teacher. He recently rushed into his neurologist's office, pale and shaking, after narrowly escaping a stroke. For 40 years, Stephen slept on his right side using an extra-high pillow, thinking it gave him a deeper, better rest. But what he didn't know was that every night, the blood vessels in his neck were getting compressed, slowing down blood flow and forming a massive clot. Do you ever wake up with a stiff neck, sudden dizziness when getting out of bed, or tingling in your hands? If that sounds familiar, stick around. That's not just normal aging. It could be your brain desperately sounding the alarm for oxygen. To truly understand this hidden danger, we must look very closely at how the human body actually works.
Let's learn.
Right up inside the human neck, there are massive and vital blood vessels known as carotid arteries. Think of them as a high-speed toll road, constantly delivering fresh, oxygen-rich blood to the brain. But when folks sleep with their heads propped up awkwardly, they accidentally compress this vital road. It is exactly like taking a regular garden hose and bending it sharply in half while the water flows. Just like the water in that bent hose, the blood flow inside the neck slows down to a dangerous crawl. Now, try to imagine keeping that intense pressure on for 7 to 8 long hours every single night. Over time, these compressed blood vessels suffer permanent damage, becoming very fragile and inflexible. Because the vital blood is moving so slowly, it starts to pool and form small clumps inside the artery. Doctors often compare it to a sluggish street gutter, where debris slowly builds up blockages over time. Night after night, those tiny microscopic clumps merge and grow into a serious blood clot in the neck. The real hidden nightmare finally begins when a piece of that massive clot suddenly breaks loose inside. It travels straight up that highway, heading rapidly into the delicate, smaller pathways of the brain. Once it gets firmly stuck in a tiny vessel, it blocks the oxygen supply instantly, triggering a stroke. The most terrifying part is that this silent process happens without any pain while a person is asleep. Medical data actually shows that these sudden strokes are incredibly common between 3 and 6 a.m. During these early hours, blood pressure naturally rises to wake you up, pushing clots into the brain. This silent chain of events is exactly why hospital emergency rooms see massive rushes of early strokes. Now, let us examine the 3 most dangerous sleeping positions that you must absolutely avoid tonight. The first extremely dangerous position is sleeping on your side using a pillow that is way too high. Many people think high pillows prevent colds, but they actually create a deadly trap for blood flow. This awkward posture severely bends the neck, causing blood to flow slowly and form deadly new clots. Take Arianto, a 69-year-old man who slept exactly like this for many consecutive long years. Doctors found a terrifying peanut-sized blood clot in his neck just moments before a massive stroke. Another patient named Wahyu was not so lucky. The deadly clot reached his brain and paralyzed him. The second very risky position is sleeping on your stomach, which many older folks mistakenly enjoy. This posture puts heavy pressure on the chest, forcing your aging heart to work 40% harder. Sleeping on your stomach is exactly like forcing your older heart to run a marathon every single night. Sumiati, who is 65, loved this posture, but constantly woke up with a racing and tired heart. Her brain was totally starved of oxygen every night, causing terrible nightmares and daily memory loss. The third hidden danger is sleeping with your head sharply turned to one side for very long periods. Bambang always slept facing his air conditioner, dangerously twisting his neck for over 10 years. This terrible habit permanently pinched his neck nerves, causing his tired hands to tremble endlessly. Sadly, the severe nerve damage was totally irreversible, requiring him to take daily pills for life. All three of these common positions secretly damage your body and can easily trigger a sudden stroke. Changing these highly dangerous habits right now is the most crucial step to protecting your aging brain. How can you actually know if your current daily sleeping position is quietly harming your brain right now? Doctors have identified 5 clear warning signs that your brain is desperately begging for more oxygen. First, waking up with a severe morning headache or a heavy migraine is a huge red flag for your health. Second, having a very stiff neck that takes a painfully long time to feel normal again in the mornings. Third, experiencing frequent numbness or tingling sensations in your hands and feet when you just wake up. Fourth, suddenly forgetting small daily details or losing your sharp memory much faster than you used to. And fifth, having frequent terrible nightmares or suddenly waking up in a real panic during the long night. If you experience at least 3 of these 5 scary signs, you must change how you sleep immediately today. So, what is the ultimate safest sleeping posture for seniors to keep blood flowing perfectly into the brain? Medical experts agree that sleeping flat on your back is absolutely the best way to protect your vital neck. You must use a very supportive pillow that is strictly 10 to 15 centimeters high and nothing taller. Your head must stay perfectly aligned with your spine, neither tilting too down nor bending way too far up. Placing a small, soft pillow right under your knees will instantly remove heavy pressure from your lower back. This perfect posture keeps your neck as straight as a pipe, letting fresh blood flow easily to your brain. Not only does this prevent fatal strokes, but it also drops your risk of dementia by a massive 30%. It actually helps your brain wash away harmful Alzheimer's proteins, keeping your memory sharp and very clear. Changing a lifelong sleeping habit is quite hard, but you must start protecting your brain tonight. Please just start by lying completely flat on your back for 30 full minutes before falling asleep. Your body will slowly adjust to this new pose, and within a week, you will sleep safely through the night. Simply place heavy pillows on your left and right sides to physically stop yourself from rolling over. If you use a cold air conditioner, never point it directly at your body because you will quickly curl up. Always set the room temperature between 24 and 25 degrees to stay perfectly relaxed. You can even set a very gentle alarm at 2 in the morning just to quickly check your sleeping pose. Going to sleep around 9 or 10 at night gives your tired body enough time to properly heal itself. Taking proper care of your aging brain is a daily choice. Preventing a stroke is completely free today. But treating a massive stroke can cost hundreds of thousands of dollars, and you might never recover. Just one single night of bad sleep could ruin your life, but making this simple change will save it. Please share this important video with your family groups right now to save someone you deeply love. Make sure to hit the like button, subscribe to our channel, and turn on the notification bell right now. Join us next week as we reveal the top foods that naturally clean out all dangerous blood blockages. Until then, stay very healthy, stay wonderfully happy, and please sleep safely to protect your mind.